40% of Americans reported using some sort of alternative medicine treatment or regimen in the past year. According to the Journal of American Medical Association, patients choose alternative methods of treatment for a handful of reasons: dissatisfaction with their conventional treatment, a more personal experience with more control over their treatment, and philosophical alignment with their personal beliefs. Now, there's a wide range of what is considered to be alternative or holistic, including acupuncture, herbs, massage, aromatherapy, meditation, and even diet based therapy. Some people choose to forego traditional medicine altogether, and some use an alternative approach in addition to their physician prescribed regimens. Most physicians obviously are of the opinion that the majority of alternative or holistic approaches are not effective or could even be harmful, but there seems to be a big push in America towards a natural process of healing. Now, a large percentage of people in our country are dissatisfied with their current or conventional medical treatment. Prescription medications are one of the big deterrents for some people. While the negative side effects of medications seem to outweigh the positives of treating or helping the disease, some prefer to turn to herbal options. For example, Tamiflu, used to treat influenza, is known to cause vomiting, dizzy spells, sleeplessness, and abdominal pain, but only claims to shorten the life of the flu by about a day or two. By contrast, fresh garlic and an elderberry supplement has no major side effects other than maybe bad breath, but it has been known to minimize your symptoms and also speed up the healing time as well. They work by ramping up your immune system so that it can fight off the virus rather than poisoning your body while attempting to poison the germs. It seems like a no-brainer to me. Another reason people are dissatisfied with the medical field is the cost. It can be blamed on any number of reasons: insurance companies, greedy doctors, the number of uninsured in America, or many other theories left up for debate another day. But it is clear that the cost of medical care has skyrocketed in the past couple of decades. When you see a bill to your insurance company where the hospital charged $12 for a dose of Tylenol, it tends to turn you off a little. The cost of medical insurance is close to unrealistic for a working family, and what it covers shrinks every year. By contrast, a more alternative approach to medicine means less hospital visits for tests, less prescriptions, and thus less cost. One specific example from my own personal experience is a basic hospital birth with no epidural, paid out of pocket with no insurance, will cost you about $20,000. An entire pregnancy, including prenatal care, the birth, and postnatal care with a midwife at a birthing center, is a flat $3,000 fee. The end result is the same, but you just saved a ton of money. Now, remember a time when your physician knew your name and not just your medical record number, or maybe even valued your opinion regarding your choices in your own healthcare decisions? That seems to be a thing of the past, and another reason people are turning to smaller and more family-operated centered care. For whatever reason, doctors' offices have become a place where you show up, and a doctor that you may or may not have ever even seen before reads your chart and makes decisions based on what's written inside. It seems rare for one to ask any further questions other than what your lab work or CT scan might show. When you visit an herbalist, a midwife, or a holistic physician, they tend to look at the whole picture. Instead of prescribing a medication to fix your high blood pressure, they look at your lifestyle. Do you exercise? Do you eat a healthy diet? Do you have too much stress in your life? Can we lower your blood pressure with relaxation techniques like meditation and lifestyle changes rather than writing a prescription that may lower your blood pressure but never really addresses the reason it was high to begin with? Sometimes a medical problem that someone may be having could be caused or triggered by something off the wall. And in the medical field, they tend to try to put everyone into a box right out of a medical journal, and that's not generally the best course of action. Every patient is different, every illness is different, and treatment varies based on those differences. Having an input on those decisions made regarding your health is also as important as looking at the entire picture. So many times doctors assume that they know what's best, and they're not particularly interested in your opinion on the treatment. While I'm not discounting the knowledge of someone who attends years of medical school, I also realize that doctors are human, and humans make mistakes, and they make human decisions. People want to be given the options and weigh the choices for their own care. There seems to be somewhat of a stigma that doctors oftentimes choose treatments for their patients based on their schedule or their paycheck rather than what the patient would prefer or even what's best sometimes. One example of this is the rapid rise in the rate of cesarean sections in the U.S. over the last 40 years. The percentage of births ending in cesarean section in 1965 was 4.5. It's risen to 32.8 since then. I feel like there are a lot of reasons for this, but one of them I think may be doctor preference. It's a whole lot easier to schedule a birth that only takes 10 minutes from start to finish than to have to show up at the hospital at 2 a.m. and then hang out for 8 to 10 hours while a mother labors to deliver naturally. Now, the last reason we'll discuss today is the philosophical preference or how your medical treatment aligns with your personal spiritual beliefs. For many Americans, choosing an alternative method of treating an illness or disease, is based on being compatible with their individual values, religions, or beliefs. Holistic medicine addresses the healing of the whole person, not just a symptom. Disease is thought to be the compilation of physical, emotional, spiritual, social, and environmental imbalance. Now, healing takes place naturally, obviously, when these aspects of life are all brought into proper balance. Yoga, reflexology, and homeopathy all originated from Taoism or Hinduism and focus on living in harmony and achieving spiritual peace to achieve maximum health benefits. For some people, alternative therapies are the norm in their culture, and therefore they've never really given a second thought to anything different. Some cultural groups even believe that illness is the result of a supernatural phenomenon and promote prayer and other spiritual means to ward off the evil. Even in the most common religion in America, Christianity, people in churches pray every day for healing during an illness or even after surgery. Now, the human body is an amazing machine. We have been given the power of self-healing and of choice. Given the opportunity and the right tools, this wonderful and complex vessel that has been given to us can do great things. Most Americans don't bat an eye at someone doing yoga or getting a massage, but might scoff at the idea of grinding up specific herbs for healing or acupuncture for pain relief. While I'm amazed at the constant advancements in modern medicine, I still have to wonder about the effectiveness of treating a symptom without actually solving a problem. Alternative medicine has been around since the beginning of the human race and before conventional medicine, and I doubt it will die off anytime soon. I think there's something to be said for methods that have been used effectively for thousands and thousands of years.